We know it's been a long pandemic, a long 18 plus months for both of your systems as well as many of our partners. Can you speak to the staffing issues that are adding additional stress and what that means? Is it a bed capacity? Is it a staff capacity that is really causing the concern that we're needing to keep people healthy and in their homes and not into our hospitals right now?
I can take the first stab at this. It's not as simple as one or the other. The way that the healthcare system is built, at least our healthcare system, and I'm sure it's going to be the same for the Unity Point team. We have a number of physical beds, and then we have a number of staff who allow us to take care of patients in those beds. So that's a finite number on both of those. So we don't have an infinite supply of ICU nurses. We have the ICU nurses that we have, and we have the number of beds that we have. So when we exceed the capacity of what we can care for, then we have no alternative but to transfer patients out. So we do everything we can to ask our staff to work over, ask our staff to work together. We've put a lot of pressure on them to maintain our capacity in the intensive care unit and in our medical units. Despite the high volume, we've maintained our capacity. So we have not reduced capacity due to staff, but we've asked a lot of those staff to maintain our maximum capacity. But once that's exceeded, there's no alternative in our community. The patients have to leave the community, and hopefully we can find a place for them if there's not capacity within our health systems locally.
Yes, Dr. Andersen, I think you're right. This is how our health system is structured as well. We have the capacity to move staff and resources sometimes to the areas where the need is the most. And however, we do not have an infinite amount of resources when it comes to bed, staff, and all that. And we did mention that there's a lot of also non-COVID related illness that is higher than usual right now that we're experiencing in the community. So we do not have just an endless number of staff, and we have been creative. Sometimes we've been able to supplement the critical care staffing, for instance, with staffing from other units, just to help. So we, in our search plan, we factored in how can we extend our resources. So in our Rock Island campus, we have created additional 10 ICU beds now because we've been busy with many COVID patients. And so, but again, our capacity to do that is not limited, is not endless. So that's the challenge that we have near our capacity in general, and that is why sometimes in a 250-mile radius, there's sometimes no ICU beds. I mean, from Chicago to all the way to Des Moines and Omaha, there may not be an ICU bed, and it's not unique to us. That's what we've seen across the region. So even though we have the ability to extend staff and resources sometimes, sometimes it's not an endless resource that we have.